So that was the start. And then when I came back to Toronto after my sort of 3 years away, I was fortunate to have a job at our old institution called the Wellesley. And there we had very little, and again, I suppose for the younger people, and there was this sort of territorial business between should gastroenterologists, endoscopists, gastroenterologists do endoscopy, or at that hospital, it was a very good general surgeon. And we had political issues as to who would look after GI bleeds and who would do all kinds of things. And I suppose in a gentle way, the turf war or the pissing contest, as some might say, started there, that we had to do as well as general surgeons did, and that endoscopy, as it soon came about, was really going to replace a lot of surgery. And the next thing that sort of influenced me, so I guess I started back at the Wellesley about 72, and we eventually developed or got some equipment. We didn't have an endoscopy room. We would do our cases in the OR. And then I read an article by a German gastroenterologist called Peter Haber on the use of the YAG laser to control GI bleeding, peptic ulcer bleeding. And that seemed to be such an exciting thing that we as endoscopists should be able to control bleeding that in the past was really the realm of the general surgeon. And then I contacted Peter Haber, and so this was probably about 76, 77, and I went to visit him in Munich. And that again was a bit of a revelation of, they would, there was no clock. A patient came to emerge bleeding 3 o'clock in the morning, that was your job. And they had anesthesia, a real team. And then when I got back, I managed through a donor to get the money to buy a YAG laser. And actually, just before that arrived, another important acquisition that we had at the Wellesley was you. So you can have all the equipment you want in the world, but you gotta have a body with a good eye and good hands. And that, to me, was the beginning of the importance of a team. And eventually we developed an endoscopy room, and it was always a struggle. Administration on one side, no money, and us pushing the envelope. We got to do better. We have to service our patients, give them good treatment. And then Paul Cortan came on, who had trained with Nib Sohendra, again a very important part of our culture and our association with great innovators and leaders in the world of endoscopy.